Hello viewers, this is Dr. Sam signing in today's Doctor's Voice. Viewers, today we'll get to know about cardiology, that means heart-related medicine. We will get to know about what is heart failure and what is the recent advancement of heart failure, and obviously what are the causes of heart failure from Dr. Lim Choon Pin, Senior Consultant Cardiology, Mount Elizabeth Novena Hospital, Singapore. Dr. Lim graduated his MBBS from National University of Singapore in the year 2003. Later, he obtained MRCP UK and Masters of Medicine in 2018. Then he received training in cardiology at National Heart Centre of Singapore and St. Vincent's Hospital, Sydney, Australia. Now he is serving at Mount Elizabeth Hospital, Novena, Singapore. And he has a special interest in managing patients of advanced heart failure, heart transplantation, and mechanical circulatory device. Viewers, let's start the discussion. Hello, Dr. Lim. Welcome to Dhaka. Welcome to SCTV.
Thank you very much for having me.
Yeah, it's our pleasure to have you in our show. As our today's topic is cardiology, and you have got a special interest in heart failure. Firstly, we'd like to begin with heart failure. What does that actually mean?
Right. Heart failure is basically a condition where the heart is unable to pump enough blood to supply the body's demands. It could happen because of various reasons. One, it could be the heart muscle of the heart is very weak, and therefore it's unable to pump blood to the rest of the body efficiently. In certain conditions, the heart muscles may be very stiff, and so if it's stiff, the pressure within the heart actually builds up, and therefore the patients may feel breathless, and that also manifests as heart failure. Other possible causes include problems within the heart anatomically. For example, if the valves of the hearts are damaged, if there are holes in the heart, or the patient is born with congenitally an abnormal heart, those can also cause heart failure.
Heart failure as well.
That's
so
right.
From the discussion, we got to know that the basic function of the heart is pump blood to other organs of the body.
Yes.
If it fails to do so,
Yes.
in that condition, you say it heart failure.
Yes.
So what is the common presentation and how the patient feels when he gets heart failure?
Right. So when the heart doesn't pump blood around the body, what happens is that the blood flow is sluggish and fluid tends to leak out of the blood vessels. And when that happens, if it leaks out of the lungs, patients will feel breathless. They actually feel breathless when they exert themselves, when they run, when they walk. In more serious conditions, even walking a few steps is going to be a problem. In even more serious conditions, they may feel breathless when they are resting or when they lie flat.
Okay.
Other possible symptoms include the water may leak out of the blood vessels in the legs, and patients may have leg swelling. The water may also accumulate in the abdomen, and therefore they get abdominal bloatedness, a loss of appetite, and overall the patient feels lethargic. They feel the lack of energy to carry on with life.
I see. So can anybody have it without being aware of it?
Yes, it is possible to have heart failure without realizing it. I think there are actually a few particular groups of patients who tend to ignore their symptoms. One is the young patients, because young people tend to have a lot of reserves. So we don't really feel unwell until you are really, really sick. So in young patients, we tend to diagnose it a little bit late. The other group includes the elderly, because a lot of people feel that feeling a bit of breathlessness is part of aging, right. So they tend to brush off their symptoms. Also, obese patients or patients who are tend to be very sedentary because they don't exert themselves much. So even though the heart is weak, they don't feel it because they don't exert themselves. Yes. So these are the groups of patients that tend to miss the diagnosis of heart failure.
All right. So you were saying that a patient with heart failure can present with leg swelling as well.
Yes.
There are some other causes of leg swelling we commonly know. How do you tend to differentiate between these causes from heart causes?
As you rightly put, the other common conditions that cause leg swelling include patients with kidney problems, as well as patients with liver problems. So these are the common, what we call differential diagnosis of heart failure. We do need to do further examination of the patients to tell which one is most likely. But we also need modern technology. We do need investigations. We need to do some blood tests to see whether the kidney function is normal, whether the liver function is normal, and also a very simple scan of the heart, which is called an echocardiogram. An echocardiogram is an ultrasound scan of the heart. It is a quick bedside scan, and we can actually see the heart function, and it can tell us whether there is heart failure on board.
Okay, so there are some based on the history and some examination, and sometimes with investigations you can surely say that whether it's due to heart cause.
Yes.
Now I'd like to know in detail about the causes and risk factor of heart failure.
Yes. So there are some risk factors of heart failure, and these are number one, hypertension, which is high blood pressure. High cholesterol is another cause, as well as diabetes is also another cause of heart failure. There are few heart conditions that will eventually lead to heart failure, and these common conditions include coronary artery disease, otherwise also known as blockages of the blood vessels that are supplying the heart. Valvular heart disease, valve problems. So the heart valve, we all have got 4 heart valves in our heart, and basically the heart valves are like doors. They open and close to allow blood to flow in one direction, and if these doors don't open properly, or if they don't close properly and cause leakages, the heart will work too hard and it gets weaker over time. Other possible causes include rhythm abnormalities, electrical rhythm abnormalities of the heart, and over a long time this can also cause the heart to be strained. Unfortunately, about 30%, about 1/3 of the patients, there's no clear cause of a heart failure. We actually term this as idiopathic cardiomyopathy, which means we don't know what's the cause of the heart muscle being weak.
Okay, so in some cases the cause cannot be dig out.
Yes.
So now I'd like to know, you were saying that coronary artery disease, that means the disease of the blood vessels of heart can be an important cause of heart failure.
Exactly.
What actually it is, and how the patient present of coronary artery disease?
Right. So a coronary artery disease basically means that there is blockages of the blood vessels that supply the heart. Now, when this happens, the heart doesn't receive enough blood supply, doesn't receive enough nutrients, doesn't receive enough oxygen, and therefore some parts of the heart muscle may actually get damaged. It may be permanent, it may be temporary, or there may be a heart attack, and therefore a certain part of it is, the blood supply to that part of the heart is suddenly cut off, and the heart undergoes irreparable damage. So when this happens, the heart actually becomes weak over time, and therefore this leads to the problem of heart failure. This treatment, the treatment of blockages in the heart arteries should ideally be done early. We should not wait for a long time before we treat this, otherwise the changes or the damage becomes irreversible.
I see. So what are the common presentations in case of coronary artery disease? You mentioned about heart attack.
Yes.
Apart from heart attack, and
Yes.
how the patient of heart attack presents actually?
Yes. So patients with blockages in heart artery or coronary artery disease typically experience chest pain. They tend to describe it as a tightness of the chest, usually on the left side or over the center of the chest. Sometimes this chest pain radiates to the shoulder or even to the jaw or the inner part of the left arm. Very commonly, it occurs when people exert themselves, and it gets better at rest. And this is what we call angina. But a heart attack is where the blood supply is suddenly cut off, where and patients tend to feel a sudden onset of severe chest pain. Often they feel sweaty, they feel out of breath, and occasionally they actually feel dizzy, and they may even faint. So this is the manifestation of a heart attack.
Heart attack.
That's right.
Well, we'll get to know more about heart attack and coronary artery disease just after a short break.
Thank you.
Viewers, it's time for a break. Stay with us. Hello viewers, welcome back to Doctor's Voice. Today we are talking about cardiology, especially we are talking about heart failure with Dr. Lim Choon Pin, Senior Consultant, Cardiology, Mount Elizabeth Novena Hospital, Singapore. Let's get back to the discussion, viewers. So previously we were talking about coronary artery disease, and you were saying that it may manifest in different ways. So now I would like to know, when you suspect this gentleman or a patient is having coronary artery disease, how do you offer treatment and management?
Mm-hmm. So first of all, we have to confirm the diagnosis of coronary artery disease. So we typically recommend patients to undergo this procedure called a coronary angiogram. It is a low risk but invasive procedure. This is where we actually insert a catheter into the patient's body through a blood vessel either in the wrist or a blood vessel in the groin. And we put the catheter to the heart. We will inject some contrast, some dye, so that the blood vessels of the heart actually light up. And there we can actually confirm whether there's blockages in the heart arteries. Now the treatment of the blockages in the heart arteries also depend on how many blockages there are, where the blockages are, and how easily treatable they are. So if it is easily treatable, we could actually do this procedure called an angioplasty, where we do a ballooning of the blood vessel to open up the blood vessel, and then we put in a stent. The stent acts as a scaffolding to keep the blood vessel open for a prolonged period of time. Now, if the anatomy or the blockages is not suitable for stenting or angioplasty, then we may recommend the patient to undergo an open heart surgery called a coronary artery bypass surgery. This is where the surgeons will use various conduits or grafts. They can take a vein from the leg, or an artery in the chest, or an artery in the non-dominant arm to actually bypass the blockages. And this is also quite a common way to treat coronary artery disease.
Okay. Sometimes we often encounter patients having some chest discomfort and having normal ECG and echocardiogram. Mm-hmm. And do you think a normal ECG, resting ECG and echocardiogram can exclude heart blockage?
Unfortunately, a resting scan or a resting ECG will not exclude a coronary artery disease. We typically need this thing called a functional testing. We need to exercise the patient because most of the blockages of heart arteries, they only manifest themselves when we exert ourselves. So we typically get the patient to either run on a treadmill machine to stress the heart, or we could also inject certain medications to stress the heart. And we have the patient undergo a scan to see whether there's any blockages. Yes.
So do you think the dye test or the angiography is the gold standard test to detect the blockage?
Yes. At the current moment, the coronary angiography is the gold standard for diagnosing blockages in the heart arteries.
Okay. Thank you. So we would like to know more about heart failure.
Yes.
And you said about the symptoms, causes,
yes,
and risk factor of heart failure.
Yes.
Now I would like to know how do you offer treatment?
Yes.
To heart failure?
So heart failure is not a death sentence. Heart failure is it is perfectly possible to live a normal life with heart failure. It involves both lifestyle modification as well as medical therapy. So in terms of lifestyle, patients diagnosed with heart failure do need to adjust their lifestyle. They do need to lead an active lifestyle. We encourage exercise. From the diet point of view, we will recommend that they take less salt. Why? Because salt acts like a sponge. It causes water retention, and therefore it increases the risks of water buildup, fluid buildup in the lungs and in the legs. So we recommend our patients to take a low salt, low sodium diet. We generally ask patients to restrict their fluid also, but depending on the severity of the heart failure, we may limit them from between 1 liter to 2 liters per day. We strongly recommend people to stop smoking because that can only lead to worsening heart failure. And alcohol, contrary to what most people believe, actually alcohol can be a toxin when taken in excessive amounts. So that's from the lifestyle point of view. There are many medications that have also been tested and proven in large trials to prolong life, that means improve survival, reduce hospitalization, because heart failure patients are associated with frequent hospital admissions, and also improve the quality of life because they actually control the amount of fluid, the hormonal level within the body. So these are, most patients will be adequately treated with just lifestyle as well as oral medications.
Okay. So you said it very clearly and very palatably that with lifestyle, dietary and some oral medicine, most of the patients can lead an active life.
Yes.
What about the recent advancement in case of heart failure management?
Yes. Unfortunately, we hope that medication can help all patients, but the truth is there are certain patients who will not respond to these medications, or there are certain patients after many, many years of heart failure, the heart can still deteriorate. Well, in the past, we didn't have very much options, but these days there are advancements. So the gold standard, of course, for an end-stage heart disease is heart transplantation to replace the diseased organ with a good donor heart. Unfortunately, it's a problem worldwide that there is a limitation in terms of the number of donor hearts. And in certain countries, you might not get you do not have the necessary governmental support for this program. So, the problem, so therein comes technological advancements. And over the last 10 to 15 years, fortunately, there has been the development of this machine called the ventricular assist device, or commonly known as an artificial heart pump, that's now available. It is implantable, and what it does is that it actually takes over the function of this failing heart. It actually takes the blood out of the left heart. It pumps the blood into the ascending aorta, which is the main artery supplying the rest of the body. The patients will have a wire that comes out of their upper abdomen, and this wire is connected to two battery power supplies. So this technology has actually helped us increase the survival of patients with end-stage heart failure.
Okay, it sounds interesting that about the artificial pump.
Yes.
So, do you think the procedure is complicated, or it's commonly done in your center?
Yes. So, well, it is still a high-risk procedure, and it's meant for the very sick patients, people with very weak heart function. So, I don't take this surgery lightly, and we only do it for patients who have a poor quality of life, patients who have recurrent heart failure admissions, or patients whom they don't really have much of a choice. There are some patients are very ill, they are on heart-lung bypass machines. Without this pump, they would never have survived. So these are the patients who are the best candidates to have a artificial heart pump implanted.
Well, we'll get to know more about heart attack and coronary artery disease just after a short break.
Thank you.
Viewers, it's time for a break. Stay with us. Hello viewers, welcome back to Doctor's Voice. Today we are talking about cardiology, especially we are talking about heart failure with Dr. Lim Choon Pin, Senior Consultant, Cardiology, Mount Elizabeth Novena Hospital, Singapore. Let's get back to the discussion, viewers. Right, so now I would like to know, all through the show we have discussed about the disease and treatment options. Now I would like to know the most important part. How can we stay away from heart diseases?
Yes, that's right. I think heart disease can potentially be preventable, not to 100%, but we certainly can reduce our individual risks significantly. So I think one of the main things is to lead an active lifestyle from a very early stage. We do know that heart disease can start as early as 20s, in our 20s. So we should start a healthy lifestyle, maybe even as early as in childhood, but we should go for an active lifestyle where we engage in physical activities. With the general recommendation is 150 minutes of exercise per week. Okay. So that's about 5 times per week of 30-minute interval of moderate intensity exercises. In terms of diet, I would recommend a low salt, low sugar, low in saturated fat diet, and rich in vitamins, rich in fruits, vegetables, as well as omega-3 fatty acids.
These are the drugs, yes. These are the supplements you prefer.
Yes, and of course the very important public health message here is also smoking. Smoking is not a good habit to have. Smoking is associated with heart diseases, lung diseases, and even cancers.
Cancers as
Yes.
well. So about the alcohol,
Yes.
would you like to shed some light?
Yes, so we do know that alcohol in excessive amounts can be a toxin to the heart. And generally, we say that men should not have more than 3 units of alcohol per day, and women 2 units of alcohol per day would be the upper limit that we should accept.
Okay, so do you think there is a recent scientific publication saying that even a little amount of alcohol can be sometimes injurious to different part of the body?
Yes, so there has been a recent publication. Right. I know there's a lot of hype about how moderate amounts of alcohol can be beneficial for the heart, but alcohol has been associated with other
various diseases as well. So Leslie, in this part of the world, firstly, when you were saying about some diseases of the valves,
yes,
and you know this part of the world, there is increased incidence of rheumatic fever and rheumatic fever related carditis, particularly mitral valvular diseases.
Yes.
I think you also see this kind of patients, and how they commonly present and what are the treatment options?
Yes, so some of these patients do present with heart failure symptoms.
Right.
They are breathless, they have leg swelling, and when we do an echocardiogram or ultrasound scan of the heart, we actually see that the valves are not opening very well in mitral stenosis. So, well, some of the treatment, initially we can just give medical treatment. We get patients to again adopt the healthy lifestyle modifications of salt restriction as well as fluid restriction. But when that doesn't work, we do have minimally invasive procedures that can help alleviate or treat the valve problem. In terms of mitral stenosis, we could use a balloon, this thing called a balloon valvuloplasty, where we can minimally invasively insert a balloon to open up the valve. And if that fails or if it's not suitable, there's also the option of an open heart surgery. And in this day and age, our surgeons are all very technically very advanced. So these open heart surgeries are not as high risk as what a lot of us think they are.
Okay. So Leslie, we are at the end of our show. What are the messages you would like to throw for our viewers?
Right. I think basically we are what we eat, and our health is really, we should all take our health into our own hands. We should start early by trying to prevent heart disease. I think it's easier to prevent it than to treat it when it happens. So I strongly recommend everybody to adopt a healthy lifestyle early on in your life, and certainly stop smoking or stop taking excessive alcohol.
Okay. Thank you, Dr. Lim. Thank you for being on my show.
Thank you very much.
I wish you have a safe journey back to your home.
It's been a pleasure being here. Thank you very much.
It's our pleasure. Viewers, that's all for today. Hope to see you on next episode. Till then, stay fine, stay tuned.